Okay, we're going to attempt this again here. All right, we're going to attempt this again here. Hopefully we can get this going. I think I got the audio fixed. I got my coffee, and yeah, we'll go with that. So this video, I want to talk about COVID-19 reinfection rate, or if it's going to happen, if it's significant. Not that I have it. I mean, I'm not reinfected. I already had it, so hopefully I don't get it again. But whether this is a real thing, if it's going to be significant, or is this just clickbait from your favorite media outlet? So first of all, let's see. What I want to do is check out this here. And let's look at CNN here. This Dutch woman dies after catching COVID-19 twice. The first reported infection death. So there's CNN giving you the D word, death. Oh my God, somebody died. This is actually not the woman, by the way. This is like, they won't let me get this stupid ad off of my thing here. So anyway, but let's first go down here and just take a look real quick. Elderly Dutch woman has become the first known person to die from catching COVID-19 twice, according to experts, raising serious questions about how long immunity antibodies can last. The woman, 89, we just talked about this like yesterday, suffered a rare type of bone marrow cancer. Oh my God, wait a second. Okay, her immune system was compromised. Really? Huh, that's interesting. Due to the cell-depleting therapy she received. So not only did she have bone marrow cancer, but she was also receiving chemotherapy. So actually, if you go down to this and you read this article, essentially what happened is she got infected with COVID-19 at 89 with bone marrow cancer and recovered. And then, hold on, I gotta get my face in here. And recovered. And then after a while, she was getting chemotherapy and she got reinfected and died. So I think the question is, can you get reinfected? Yes, you can get reinfected. I don't think that that's a huge question. The question more is it significant, and should you and I be concerned that we're going to get reinfected, and where does this put us when we're thinking about COVID, and do we need to like stop everything and be like, oh my God, we need to like stay indoors for the about 10 years so that way nobody gets reinfected with COVID. So what I wanted to point out right now is just that places like CNN and Fox and all the other media outlets are going to put out articles like this. These are the exceptions to the rules. And I think it's just important to recognize that, and that there's going to be a lot of clickbait surrounding whatever COVID stuff. And so you always have to go kind of look a little bit deeper and say, what happened with this scenario, and on a larger scale, like what is going on. And are people getting reinfected like routinely, or and having a worse disease? Because they're kind of saying like, oh, she had a worse disease, she died after getting reinfected. Like, this doesn't count. Like, she was on chemotherapy, like, oh my God. Anyway, so I did try to look up some other things here that we can take a look at. So the Lancet, infectious diseases, what reinfections mean for COVID-19. So here's the 4 people who have been confirmed to be reinfected. Hong Kong, there was a male, he was 33 years old. His first infection was mild. His second infection was asymptomatic. Okay, intervening period, 142 days. Antibody after first infection was negative. Interesting, right? Antibody after reinfection and he's positive. He's got an IgG positive. Second person, well, on their list is male, 25. His mild disease. He was hospitalized after, which we're assuming is a worse disease than the first one. Intervening days, 48. We don't know his antibody status before, but he's positive for IgM and IgG now. So still not sure if he became positive with his first infection. Belgium, female, 51, milder disease, second time, 93 days, unsure of antibodies. She's positive now. Ecuador, male, 46, mild. He had worsening disease, 63 days, IgM and IgG, and he's positive for both now. So these are so far just anecdotal evidence, because we don't have like a real data set that's powered correctly. It's not a large sample size or something like that. So we can't really say too much about these, except, you know, kind of keep our ears open for other reinfections and things like that. I think for me, I'm not going to probably let it change what I've been doing. And even though, you know, I got infected the first time, I don't think I'm going to change too much otherwise. I think that, you know, I look at it kind of like driving a car. Like, I'm going to get out there, I'm going to drive the car, I got to put a seatbelt on, I should stop at stoplights, I should do the speed limit in a reasonable fashion and protect myself, like in those kind of ways. Like, if I'm going to drive the car, you got to do, you know, certain things to not get in a head-on collision at 80 miles an hour. So that's kind of what I look at COVID reinfection as well, or just infection in general. What was the other things? Oh, the other things I wanted to look at was, no, not that one. This is, the interpretation. This is a different study here. Let me put this up here. So the interpretation of where'd it go? Of reinfection, essentially, genetic discordance of SARS-2 specimen was greater than could be accounted for by short-term in vivo evolution. So they're saying that this is a true thing, that as people are getting reinfected, this finding suggests the patient was infected by SARS-CoV-2 on 2 separate occasions by genetically distinct virus. Thus, previous exposure to SARS-CoV-2 might not guarantee total immunity in all cases. All individuals, whether previously diagnosed with COVID-19 or not, should take identical precautions to avoid infection with SARS-CoV-2. So that's kind of exactly what I said. The implications of reinfection could be relevant for vaccine development application. So I guess my only question is like, is if the reinfection is real and has been sort of a mutated virus, or you have an antigenic drift, enough for the virus to be changed so you could get reinfected, like, then is the vaccine that's supposedly going to save everybody, is that going to be effective against all the mutations as well? So I think that's remains to be seen. That's something in my mind. I'm like, okay, well, you want to get everybody vaccinated, but is it going to actually help in the long term? Or is it going to be like a yearly vaccination like the flu, which is, a whole another ball of wax and great for pharmaceutical industries, but I'm not sure how awesome it is for everybody else that is not highly susceptible to a big problem, like, because we talked about, like yesterday, 50% of all deaths were from patients in nursing homes. So if we can take that subset of patients and say, okay, well, these people need to be vaccinated every year, like, then that's maybe reasonable. But just being a blanket vaccination for everybody that may or may not work, I'm not a huge fan of. But for those that are susceptible, or those that are going to be around susceptible people, like healthcare providers and things like that, I think that's then reasonable. So I did not go to the chat. Let's go check out the chat and see if we have any questions. What's going on? Is it wise to go volunteer at a hospital right now as a pre-med student during the pandemic? So I think it's okay to volunteer as a pre-med student. Some places won't let you do that right now, but I think it's fine. Are you putting yourself at somewhat of a risk? Yes. If you're a pre-med student, you're usually younger and healthier and less risk overall of having the virus or having a significant problem with the virus. So I think it's fine. I think you shouldn't stop your life for this, especially if you're somebody that's not really that susceptible. Spirituality is the only way to stop the chaos. Okay. Multiverse Buster. Okay. No antibodies. Had SARS in COVID-2 in January, miserable, tested in June, no antibodies present. Yeah, so I think, I didn't have antibodies. I never reacted with antibodies to the hepatitis B vaccination. So I think you'll definitely have some people that are not going to have antibodies at all, or maybe not long lasting. So, that's just kind of how it is. Again, I don't think you can just stop everything and stop your life because of this virus. And also, I was looking up the strains too. There's quite a few different strains, and it seems that the one in North America is much more infectious and transmits a little bit easier, but it is also less virulent. So maybe over time that will change as well, and it'll be more infectious but less virulent, as in, it's totally asymptomatic for most people. I don't know. Anyway, all right, I think that's about it. I just wanted to do a quick video there. So I think that you will see this quite a bit for clickbait reasons, but I think we will also see some reinfection. However, I'm going to go out on a limb and say it won't be that significant for most people. And when I say most, I mean like 99.9% of people on the planet. I think there will be some significant problems for a couple people, as we just saw with that woman who died from her second infection. But those will probably come with some sort of, other issue that you can trace back to, like, I had cancer and I was undergoing chemotherapy and I caught, this virus again. I mean, probably if she got any other infection, like MRSA or, C. diff, she probably would have died too. So tough to say. Anyway, thank you guys so much for watching again, and I will see you next one. Subscribe, like, share, all that good stuff. I'll see you next time.